her today. Oh, actually, I already did.
All right?
You're in on Saturday?
All right,
Thank you for
another way.
holding. How may I help you?
You need to mute Paul's phone.
Okay, everybody ready?
Okay, book her.
You wanted to talk to Sheila to see if he in today.
Right. Okay, because that's why before I told her, before I send her, I have to double check to see. Okay,
Everybody
so book
ready?
her and let her call
Okay.
Christina.
Do you have paper?
Oops, let me just check one thing here. Okay,
Just
good.
wait.
All right. So now we're gonna just hypothetically say, okay, our patient had been in a month ago for their, initial prenatal visit, so they're coming back in now for their follow-up the following month. So the visit type, of course, is just going to change from the OB prenatal initial just to an OB prenatal. Okay? So nothing has to go in for reason for visit because, we know what she's coming in for. So at this point, again, when the patient is collected from the exam room, the nurse is going to put her in exam room. She's going to go to tracking, and she's going to indicate what exam room the patient is in. Okay? And, of course, their appointment information will display up here. Could your patients possibly have two appointments in the same day?
Yes.
Okay. If that happens, okay, when you get into this tracking window, there's going to be nothing displayed in the appointment information. But over here in the corner where I'm circling, you're going to have a little drop-down arrow. And when you select the drop-down, it's going to list the appointment. So you have to make sure you select the appropriate appointment that you're working with.
Okay, even if they have an appointment with the GYN and maybe their medical and maybe the cardiologist, it's still going to...
Yeah, if it's scheduled as two appointments, that's how it's going to work in here.
Okay.
Okay, so just, if you got to make sure the appointment information is displayed here, or it's not going to update your inbox.
Okay.
All right, if they have just the one appointment, it's automatically going to be in there for you. So we'll put them into exam room 1, and again, we'll say they are with nursing, because the nursing is going to go ahead and triage and interview the patient. So it's all going to upload on save and close. So again, if we came out to the inbox, we would see our patients in exam room 1, and the status is they're with nursing. So from there, again, the nurse could fire right down to her nurse doc. She's going to go ahead and do her component to the visit. She's going to double-click or right-click Add New, and she's going to put her vital signs in here. So I'm going to go ahead and just get them in. So I'm going to put in, she's Pardine Gross since her last visit, so 5'7". We'll say her weight now is 140. She's being bad. Yeah, she's just eating like a little piggy. She's eating for a troop. All right, her blood pressure's up a little bit now, so I'm elevating it so you can see the little alerts that are popping up.
Okay.
Not that you don't know that that's elevated. You know that. Okay, pulse, but it just gives you that little, little flag there. Pain scale, I think that's, important. Again, everything else over here, ladies, is 100% optional. Was she sitting? Was she standing? Was she laying down? If you've got a hypertensive pregnant patient, maybe you're taking multiple sets of pressures because we want to get her sitting, standing, different sides, whatever the case may be. What the method was, 100% optional. All right. And a lot of them, dressed without shoes, please. Let's get that little bit of weight off. Okay, save and close. So again, if you need, if her blood pressure was elevated or you were, concerned and you wanted to take another set of pressures, say in 15 minutes, you would just leave her in the room. Like I said, take away her cell phone, take away her coffee, things that she shouldn't have. Nice, calm, even breathing. Come back in. You would right-click Add New, and you would add another set of pressures. Okay, so you can add as many as you like in there. And what's nice about that, too, if you have a hypertensive patient, maybe we're monitoring that, you can go to File, and you can go to Graphing, and you can actually start graphing items in here, like her BMI, her height, her weight, things like that. So that's good to have. All right, so we can go ahead and review allergies. If there were no changes, she would just select allergies reviewed, no change. Again, medication, she can do the medication review right from here, or reconciliation, whichever you want to call it. And remember, okay, we're going to say that these are been a reviewed medication list. You have to do it line item by line item. You select the medication. She says she's still taking it. We say patient states compliant. We save it to the chart. You come to the next one. It's a wash, rinse, and repeat scenario, ladies. I can't make it any easier. If your patient's on 15 different meds, it's going to take a few minutes. And then if your patient says she's no longer taking something, you would indicate no longer taking, and then you would fire to the medication module and stop the medication. So there's your full circle reconciliation. So I could double click right here in the grid. Oops, keep forgetting. Double click on the grid. It's going to fire up the there it is. And I double clicked, so that's why my template came back over it. So I could come right in here now, and I could stop this Vicodin. All right, and I could even put a little stop note on it. You have this add note. So if you wanted to just come in here and indicate that it's a stop note, and you could say, patient states no longer needed. If you just want to document why, she stopped her medication and it wasn't an order from the doctor. Of course, we wouldn't be taking Vicodin when we were pregnant anyway. All right, so there's my little stop note. Make my little hover go away. Go away, go away. Come on.
Quick
All right.
question not related to this patient. If the patient is taking blood control and the patient stops taking the blood control, do we have to note here that patient stopped?
I would. Yeah, I definitely would. I would indicate the patient took themselves off the medication. Absolutely. And then save and close. Do you do a UA at every visit when the patient comes in?
Weigh them?
Do you do a urinalysis?
Yes.
Okay. So at that point, she's already when you collect her, you're going to take her to the area where you do her height and weight. At that point, she's probably handed the spec cup and then goes to the ladies' room.
Correct.
All right, and okay. So that's usually the flow, and then you wait for her, and then you collect her, and you bring her, you grab the spec, it goes over to the lab section, and then patient goes to the room. So whenever the nurse is ready to come in to the office diagnostics template and actually grab the urinalysis standing order here, we highlight it, okay? We go ahead then now, and we go to the detail button. So after it's been interpreted, we can say see detail and go ahead and chart out, what the results were. Do you get that little printout that comes out of the machine?
No, we do it manually.
Okay. So we can go ahead and chart it all out here. Click OK. So that's going to put all your detail right down here. We're going to bill for this because even though she's coming in for a prenatal visit, I do believe you can still bill for this. But if you don't, you just don't select the Submit to Super Bill button.
Okay.
All right, so I'm going to click it and then place order. That's the important thing. That completes the whole process. It finalizes the order. All right, it bills for it, and then it reconciles the whole order. So you'll see here it is right here. It's been completed, and there are the results. So really slick, super workflow. Love it. And at this point, if there was nothing else she had to do, she's going to generate her intake note. All right, so pretty much, again, tweaks and tweaks and tweaks based off of your workflow. I'll never tell you how to do your workflow. I just will always give suggestions. Because I'm not there, I don't know how things exactly work for you. So again, this just pulls in some general information, date of her last PAP, date of her last mammogram. The whole vital signs we're able to fire onto here. We'll see her active meds. I've got the medication reconciliation that's done. All right, Vicodin that was stopped because she's no longer taking. Her allergies. There's the office lab, the order that it's resulted. And I have ordered a lot on this poor little patient. So as you can see, here's all my studies, diagnostics, poor thing. Oh, my Lord, have mercy. Okay, and then, it'll have the provider's name as it's pulling from here. So you got to make sure you have the right provider selected. Now, if this was supposed to be for a different provider, but you have your default provider in here as Jack, all you have to do, ladies, is close the document, reselect the doctor from the drop-down here, like maybe this was supposed to be Dr. Dorfman. All right, close the document and just regenerate it again. And that'll put Dr. Dorfman's name on it. But that's the importance of, I'm sure, Leanne, you heard her say it throughout your training, because you see here it's going to want to override your 4-point check. Okay, so you make sure you're charting 1 in the correct patient's chart, 2, you've got the right location and provider, but most importantly, you're charting in the right encounter. All right, so the date and time of that encounter, and it displays right here. So you would see 6/2, say at 9 a.m.
Okay.
All right, and then now if I scroll to the bottom, okay, there's the provider now. So it toggled it over to Dr. Dorfman. So it looks at that field to put the doctor's name on it. And then who generated it? Well, I'm logged in as the NextGen admin, so there you go. Okay? Then, at that point, and this would be the process flow again for, the prenatal visit. So at this point, she would then track her patient as being ready to see the provider if indeed she's done. All right? So we change it out to, waiting for provider. All right? And then the doctor at any given time, he could be coming down the hall with his laptop. He could be coming out of the break room with a cup of coffee. He can go to his inbox, and he would see, oh, my patient's waiting for me.
Okay.
Okay, so that's the importance of tracking. Even though you're still going to have charts in the beginning, you still want to start utilizing that tracking because I don't know if you're going to do like a 3-chart pull for like your GIN patients that at the 3rd pull the chart goes away. Then there's nothing hanging outside the door. The tablet now becomes the safety mechanism that the user is holding to their chest like they used to hold the chart. Okay, because we all know what that's like. Okay. All right, so at that point, they would exit nurse, enter doctor. So when the doctor comes into the room, whether, again, if he's going to chart after the visit or during the visit, he can go right to his inbox. He would go right to the patient's appointment, and then he could right-click, go to patient's chart. All right, so he'll be right in the patient's chart, and then his process will be coming down here. Now, again, based on your workflow, does he want to start at gestational age and work through the tabs? If there's anything additional, based on the interval of the visit, this is the 2nd visit, it's not the 2nd trimester. That's not going to happen for 2 more months. So is he going to go over anything in medical history? Is he going to go over anything or she in social? Are they going to go over lab results? Anything else they need to tweak on education? But if none of these tabs would be utilized during that next visit, wow, that was interesting. Everything just flashed. He would go right to prenatal detail. And this is where, he's listening, he's feeling, he's listening for the baby heartbeat. You can hear the heartbeat. Everything's going on. A lot of times these subsequent visits are very brief. So they're going to come to their problem detail and come in here and right-click Add New. And they're going to indicate if there's a problem or something. If there's nothing, again, grab the free text line, and just say, follow-up visit. And then date stamp it, and then go ahead and free text in the visit info. And that's really all there is to it. Okay? If he's going to, do an additional exam, or again, if the patient, indicates an additional problem, all right, they can come to encounter detail and chart that information. So basically, after they do their little problem detail, they would come down here again. All right, it's got pregnancy. Come on, come with me. They would schedule the next follow-up visit. Okay, so patient now would be coming back in, I'll say 2 months for this one since it's today's date, so it's going to give us 8/2. Save that to the chart. And it's optional to generate the prenatal record. It doesn't have to be generated at every visit, but if they would like to, just to see it for that comfort level, then absolutely pull the trigger on that, and it will regenerate the crystal report. All right? So again, if patient now, oh, doctor, by the way, I've got a horn growing out of the back of my head. Okay? Encounter detail. And we would go ahead then now and indicate that the patient is actually presenting with an additional issue. So, again, I'll come in, I'll just grab this free text line, and this is my little joke. I've been doing this for 16 years, working in this business, horn in head. And then they will HBI this chief complaint, and you're going to get a nice little generic template. You know, when did this horn come out? Well, it came out, 5 minutes ago. All right. And a lot of this stuff may not apply. And then, again, go ahead and free text in
Yes, it's on 18th
the
Street.
data. And you've got phrases on here as well that can
We're
be
here exactly
used.
now.
Save and close. All right. Then again,
Where you know,
if
ma'am?
there's a review system set done, if it's normal, we
18
just click the
between
check
where
box.
and
All
where?
right. Head obviously wouldn't be normal, but
If
I'll
you
just go ahead and
face
click
it-
off a
if
couple
you
of things
face it
here.
flat, which
So
side you-
I'll
which
come
side you
into
want,
head,
right
ears,
side or
eyes,
the
nose,
left
and
side?
throat. Okay. And head, we'd have to put a little comment in there, I think. Patient definitely has a horn in the head.
And go in that 18th Street side, okay? No. You need
Okay.
to go over to the
You may want to be
right,
referring her
the
to a
right across the street
orthopedic
and go
doctor
down
or
18th
something.
Street. It's on your left side.
All right,
When
so I'll
you're
save
going
and
into
close on
18th
that.
Street. Church towards
Again, the
Alma
exam.
Mall.
This actually is going to generate a document here, everybody. So don't think that's a shortcut. But again, a normal exam is just clicking the checkbox,
You said you at 18th Street
right?
now.
And then if I have to drill
And
into the
Church,
body
cross
system,
over the street 'cause you're on
okay,
the
then I
left
would
side
actually
facing
drill into it. So
Cross
again,
over the
something
street
going
on
on with
right
the
side
head.
and go down 18th
All right, I
Street.
can come in and say skull, not normal. All right, here's your pick list for it, and I can just say asymmetrical and grab the free text line and say horn growing because they're a unicorn now. And then save and close. Hey, gotta make training fun, right? In addition to the pregnancy, which is automatically going to fire in there for you because we pick, the visit type as being an OB prenatal visit, we could then go ahead and add a second assessment. We'll never find one for horn and head. But everything else works exactly the same way. If you need to, again, if at this point, if the doctor wanted to order labs and office procedures and diagnostics, we try and, get them in the flow of doing it all from this one template so they're not toggling back and forth. So maybe I'm going to order a CBC today. And when I'm done, I'm going to place that order. Then I'm also going to come over. And again, here's that tasking windows that fires. If it's not necessary to fire a task to a user, then you just simply cancel it. That cancels the task. Then if they were going to do an office procedure or an injection, okay, again, we could come in here for pregnancy. Maybe we're going to do a, I don't know, maybe we'll do a vitamin B6. All right, place the order. Fires the task window. I know that can be a little bothersome, but I think it's better to just cancel it and to not have it fire at all. Diagnostic studies, well, she's got a horn growing out of her head. But when we look at this one, okay, that's why I'm showing you, that's why I use horn and head. This is more OB-related types of diagnostics, your ultrasounds, echoes, things of that nature. If you need to reach out to a different template to get to, say, an MRI of the skull, the head, or whatnot, you're just going to come over here to view additional diagnostics. There's an interesting little field. That should be hidden. And I see that one up here, too. These little fields should be hidden on these templates. But if you come into View Diagnostics, see where it takes you? It's as if you were on the plan. And here's where you could come in and say, okay, I need to get an MRI or just an X-ray of the head. So when they select this little down arrow, this would be all the, items that are in here. And these service item masters, ladies, can all be edited. You can add any type of X-rays you need into any of these types of X-rays from the database pick list. All right, so if we wanted to get an X-ray of the skull, all right, and if I had horn and head up here, that's what I would be doing it for. And then, of course, place your order. All right, again, tasking window fires. Save and close. It's going to take me right back to where I was. And then again, if, at this point they determined patient was a high risk, they could go ahead and do a referral. So again, over to referrals. Okay, they would indicate, the specialty again. Click it in the specialty field. We're going to send them to an orthopedic. Sorry, just typed an O, but let's see, there it is. Orthosurge. All right, and the indication, if I had horn in head, it would be there.
Okay.
And then the clinical reason, patient's got a horn in the head. All right, and the time limit you would like it done in. So I'm in a brand new encounter, so you can see I have no referrals ordered this encounter because I did them on a previous encounter.
Right.
All right, so evaluate, treat. Okay, so we'll do horn in head, and we'd probably like this done ASAP. All right, clinical information, help this patient. All right, and then of course we could say make sure we include documents, but I haven't generated a document yet other than the nurse master to this encounter. So if you want the documentation to go with it, you either have to generate it beforehand, or you could just come in here and indicate, to send chart note when completed. Because at this point, usually the chart note may not be done, and then add it. All right, so that actually places the order. Okay. So from there, again, they could fire after they complete all that. They can go right back over to their encounter detail, and they're right back to where they were, so they could finish things up. All right, so you can see it's got a real smooth flow to it. All right, so I can come down here. Here's my orders. Here's medications. I have to do a new medication order. And Leva and I talked about yesterday if you've got any fellows or residents at your practice or nurse practitioners, after they see the patient, if they need to submit this to their supervising physician for review, what all they have to do is click that checkbox, and it fires up the task window so they can send it to their supervising physician. The supervising physician will get this as a task, so when they accept it, like I showed you, right-click, go to patient's template, it forces you to accept. It will close your workflow window and take you right to the chart. The physician can review the chart, and then when they're done, all they have to do is come in and say, I've reviewed and agree with the diagnosis and treatment plan. So if that does come up for you there. Okay, so that's that one. I'm going to save all this by clicking this little diskette. And if I hadn't clicked that diskette, if I attempted to close, it would prompt me to save my changes if I hadn't. So I'm going to create another new encounter. This is our patient coming in now after labor and delivery. So I'm going to pull in the OBGYN home. And I'm now going to indicate my visit type as being, let's see, OB postpartum. Okay, because now what I can do is, again, the same rules apply. Let me pin my history toolbar away. The nurse can do all of her components. And then the physician really can start at postpartum visit here. These are just two templates that really are not, there's not too much to them, but it allows them to chart, everything. So patients coming in for, postpartum visit. All right. There's really, if there was anything, if she was complaining about anything, the HPI template is just a generic free form with their phrases. So they could just, free text in maybe anything the patient is reporting. So I'll just type in test, and I'm going to save and close. They're going to then go on to do the delivery type. We'll say it was vaginal forceps. A very brief review of systems as well as exams. So, they interview the patient. Okay, everything's normal. If it wasn't, we would drill into the body system, say constitutional. It's not going to look any different than what you've been seeing over the last 2 weeks. So we can do that. Then we can go into the exam. Same thing. If it's a norm, we're just going to check the check boxes. Drill into the body system, active text link for findings. Constitutional, off you go. Little couple of radio buttons here. Is mom doing breastfeeding, bottle feeding in both? Is the baby enrolled in with WIC and the newborn care visit completed? I didn't add vitals, so nothing is showing here. So we could then come in, just add the common assessment. All right, and let me see which, I don't know what code is used.
There's a prenatal postpartum.
Obstetric care continued.
Postpartum follow-up.
Yeah, I'm just trying, I don't know where it is on here. This is where I struggle, I start.
To the far right.
Far right, oh, here we go. I'll just fire that one in. Okay, and then everything else follows suit, ladies, in regards to, if any labs, again, have to be ordered, office procedures or diagnostics. There's the plan, which works exactly as, how you saw last week and part of yesterday. A nice little free text comments field here. Okay, and then the other option or tab on here is the second tab up here is for the physician to document the outcome of the pregnancy. So this one doesn't want to get left behind because anything that you chart here is going to update your patient's history in both the OB suite and the Gen suite and family practice. All this information is all going to
flow right in.
across all three. So you do want to fill this in. The baby number 7, okay, and this was full term. It was a live infant. It was a female. Pregnancy in, put a date in of, I'll just go back a week here, a couple days. Time of delivery was at 1, let's see, 18, and the AM, all right, look at that, isn't that horrible? 6 weeks. All right, we'll say that was just vaginal forceps, the baby's weight. So again, this will all share right over to all the history for you. It's a beautiful thing. Till hours in labor, if necessary, maybe she's in labor for 14 hours. All right, and you could break it down if you wanted to. I have no idea what this means, everybody.
Scoring system for the baby.
Oh, okay. First minute, so how the baby's responding and stuff?
Yeah.
Oh, okay. Well, we'll give them 10s. Our babies, is that good?
Oh, it's the best. Only pediatricians' babies get 10s.
Oh, okay.
They're the ones that
I learned something new today. Okay. Hospital provider, again, these are pick lists. They're going to have to be edited by you to put in your hospital as well. The provider is going to pull up your provider table. Okay. Labor induction, if it was done. I had to be induced. That wasn't very fun. Let's see. That made labor so much harder.
Mm-hmm.
First baby I had my son in 6.5 hours. And he was almost 10 pounds. Let's see. So we're going to save all this information. And then again, of course, support information, support folks and stuff. So again, all this information is going to update all your patients' past history. And the documentation for these 2 items, because I don't believe it's on the postpartum visit. Let me take a quick peek. Because you've seen you've got those little links to generate documents. So let me just take a quick peek here. This will generate a patient plan. All right, so if there was anything, documented, and again, this may all be part of the checkout process that the patient has given their plan. But you can see right here, the document that's generated is patient plan. All right, so there it is. Thank you for choosing us. There's postpartum follow-up. If the doctor had indicated any orders, everything would be in here. I didn't do any. But the official chart note itself is going to be generated by this preview button over here. All right, so that's actually going to generate, it's actually generating the OB master, because this doesn't need to go to the hospital. This is just part of your chart record. That's my understanding. Correct me if I'm wrong.
Mm-hmm.
Okay, so this will be generated right to the chart. So it's evaluating all the macros that we just charted. My exams are going through right now. The neck, neurological, psyche, respiration, skin. There's a lot of macros it's evaluating, but it creates a nice document. And I know this can take sometimes upwards of 10, 14, 18 seconds, but there's your final chart note. So she's here for her postpartum visit. Okay, and there's my little note I wrote in there. There's all the gestational outcomes of her pregnancy. Okay, postpartum checkup.
Let me speak to pediatrics.
Right, and list her allergies and meds and patient responses to things. There's my review of systems. There's my physical exam. There's my assessment. There are my meds. And then the doctor and who generated the document. And again, everything now a permanent part of your patient's history right over here. I utilized OBGYN home. I utilized the postpartum visit and the pregnancy history and generated a patient plan and the OB master. How cool is that? I get very, very passionate about this because I've been doing this for so long. If I had had this, like I said, I got catapulted into this industry back in Massachusetts when I was working for a team of 16 gastroenterologists, and we migrated onto a very generic, all free texting when the electronic health record was just starting to really emerge. So everything was just free texting. You free texted your whole soap note, and you were able to add some meds and allergies, and that was about it. But it just intrigued me to now this is what I do. So I love it. And I hope you do too.
Okay, so
Can we open it up for questions now?
yeah, I want to go over the OB visit, not OB, sorry, the gen visit.
The gin visit? The fast way? Is that Leva talking? Okay, we're going to do the fast way, right?
Okay.
With the quick visit?
Quick visit or standard visit.
Okay.
Yeah, being that we have to treat every patient as new when we go live, just to familiarize.
Yeah, let me pick a new patient since I've pretty much beat this one. I mean, you can see all the encounters I created for. Oops, there goes my silly tab button not working again. Click in the field. Okay, TEST. We'll pick a different Mary. I'm hitting enter on my keyboard. I don't have to actually click look up. All right, let's find one. Someone that's too old. Based on age, I'll go ahead and pick this one here. Hit enter on my keyboard. Come on. There we go. So it closed my other Mary's chart. It's taking me now to this Mary test chart, and she has no encounter. So I'm going to say yes. All right, so encounter 1 created 1119 for Dr. Dorfman. So again, patient is scheduled to come in from the inbox. You're going to right-click to go right to her chart, and remember that encounter will be living in her history toolbar already. You should never have to create an encounter for a patient that's scheduled to come in. If you can't see those encounters, make sure everybody under Tools and Preferences on the second tab, this is the checkbox that's going to drive that. If this isn't checked off, you're not going to see the encounters created from EPM. Okay, so if anything, make sure your users have that one checked off. Okay. All right, so back to history. All right, so here's my encounter for her appointment today at 11:19. We're going to come down to the grid, and we're going to pull in our OBGYN home. All right, and we're going to treat her as a new patient. Are you going to be capturing your patient's photos from EPM?
Yes.
Okay, this is where her photo will show up right here. Okay, so you can actually verify it is the patient that presents with the insurance card. All right, so the visit's going to be office visit Jen. All right, and the reason for visit, actually, let me take that back. If she's coming in for her well woman, okay, it's going to be preventative exam. If she's coming in for a problem, vaginal discharge, something to that effect, then it's going to be an office visit Jen. But it doesn't matter. This just drives the billing per se, but it's not going to change the flow of the templates over here. Okay, but it's, you know, for the preventative exam obviously is going to generate that preventative visit code as opposed to a 213, 214, so on and so forth. All right, so preventative medicine she's coming in for, and this is going to be her annual visit. All right. So from here again, now we talked yesterday, since this is a new patient, the nursing component, what components is she going to be, doing in here? Now, there's some things you can chart right on this, this homepage here. I'm going to leave it up to the nurses. They could come in and, right from here if they wanted to put in, the last LMP. They could put in, if this patient's in menopause or if they've had a hysterectomy. But there's really not a lot on here. So that's why they may want to start floating down this left navigational toolbar. Maybe the first thing they want to do is come right down to nurse doc.
What's with that and the one standing up for the CTM?
All right. So when they come in here, now as part of meaningful use, everybody, and I don't know if specialties are excluded, but there is a screening summary. Did Leanne go over this with you?
Yeah, she went over.
Yeah, there's just for year one meaningful use, what has to be screened is smoking over the age, for patients over the age of 13. So when you click into this, it's going to open up a template that's got a different screenings on here. You've got social caffeine, you've got last pap, things like that. And actually, this is nice because if you put the last pap in here, it's actually going to, it's going to update. But if we say this patient,
Put it under 97. You got to put it under 62.
is a non-smoker, which is put no in there. And then if you don't utilize all of the screening tools in here when you save and close, it is going to say you haven't screened everything. Do you want to proceed? And you just say yes. Okay, then of course vitals, right-click, add new. I don't think we have to beat that one into the ground. The same thing, they would add and update allergies.
Quick question, Leanne. I'm sorry. Suzanne, I'm sorry.
No, it's okay.
The gen visit new. For the nurses, do we go to the nurse doc or do we have to go through the different steps?
I would prefer they come to the nurse doc because this is where they can put in their vitals. They can do the last LMP. They can indicate, excuse me, when the last PAP was. This really will let them get through a lot of the charting right from this template.
So the blood work was good. Right on the borderline anemia. I call this Brooklyn anemia. It's diet.
Okay. I'll say they've got no medication, no allergies.
I'll take a multivitamin with iron. That wouldn't be
Okay, then if, again, you're going to do a urinalysis on these patients, right?
HPV is negative. There was some atypical cells on the path.
You would order an office diagnostic of the urinalysis, so we just select it here.
We have to do another pap smear next year.
We go to the detail and we can say it's normal.
That was your big worry. Okay. Your ultrasound report.
Alrighty, we'll click OK. And then we're going to say submit the bill and place the order.
Looks pretty okay, except for one small fibroid. Looks like you got a
talks to a
fibroid
patient.
about this big in the front part.
All right.
Not gigantic.
Now again, like I just talked with Leva yesterday, if the nurse is going to do
The
history,
ultrasonographer looked
which
at this,
she
kind of was
indicated
like, well, it just looks
all right, and she's also going to be doing HPI, she can start working her way through these other templates here.
something else, an adenomyoma or
So
something
again,
like that, which is
based on your workflow,
pain of the period.
and what she's going to be doing is going to determine, and her nurses may come up with a nice flow based on how they interview the patient, how they're going to utilize the template. But if they're going to be, there wouldn't be anything to HPI because she's coming in for her annual visit. Review of systems, if she fires into that template, if she indeed is going to do this, when you click there, again, ROS defaults, we have a globally normal GIN patient that can be fired in. All right, and remember, you can build your own. All right, and then if anything, it's going to fire in everything as a negative, but if anything needs to be tweaked, say something in constitutional, I could come in there and say that she's had changes in appetite. All right, it's actually gonna it's gonna add that to constitutional. So negative for the chills and fever, but she's had some changes in appetite. Then she can come back over and fire right into past medical history. All right, and I'm just going to say that there is no relevant history, and that this always first time, always detailed first time. So you have a full chart note. All right, but if you do have to add, which again for Gravida and Parity down here, I could come down here and just if there's no relevant history, I could just come down here and click this little add button, and it's going to pull me up. Oops. Oh, what's it doing here? Oh, it doesn't do what it used to do. We're going to have to click it here. If you want to get, you can add it here. All right, so maybe she's had one full term, and that's it. All the other histories.
1 second, ma'am.
And then just a little bit further down this template, these are, you can also enter them in here. So if you just wanted to put one in, you could just start firing them in. And live at present. And then, of course, that wonderful pregnancy history, everybody. She's had, previous pregnancies. Here is where you do that thing. Just a nice little template. All right, maybe it's a female, born March 2001. If they don't know the rest of this information, they're not required fields, but, of course, the more the better. Save and close. So there's your past history. Back to the left nav, again, are they going to do family history? All right, then they would come in and say detailed document, add family history. Mother is alive and well. Finish with mother, hit save. Going to go to Papa. He's alive and well. We're done with Papa. We're going to hit save. When we're done with family, if there's a family history of, allergies, save, move on. So each family member, save in between. Put the wall in between each one of them. And then, of course, social history, which we talked about yesterday. Again, I think this template's going to require a little more analyzing to determine exactly what points on this template do you want to chart in comparison to what's going to pull into the OB suite. And so it shares amongst all your specialties there, family practice, gyn, and OB. And don't forget that confidential template. And realistically, what I understand at this point, the nurse would be done with her component. All right, so she can come back to nurse doc. So you can see it's a little clicking around. So your nurses may find a way that makes them feel more comfortable. But once they're done with their part, they're going to generate their intake note. I'll let that go ahead and chart. It's not anywhere near as large as the final chart note, the Gyn Master. So it's going to pull everything we just charted. All right, here for her annual visit. Okay, past medical history there. You can say reviewed, no changes. There's a little bit. I put just some very brief information in here. There's a review of systems that we did. So at this point, if the nurse would be done, she would then track this patient to be ready for the provider. So we'd come out, we track. Oops, I don't think I even tracked her. All right, then we'll say waiting for provider. Okay, and then she can move on to her next patient. So exit nurse, enter doctor. Again, I think you said everyone's going to have laptops, so there's not going to be any hardware in the room. He may come in, just put his computer down, and then go ahead and proceed with his visit. So, but when he does access from the inbox, he's going to go to the patient's chart, and he's going to right-click, go right to the patient's chart. And from that point, when he gets in, all right, he can start with a review of everything the nurse put in. But he can come right down here to Gyn office visit. This is really his starting or her starting point. All right? And from here, okay, because you can see everything is now tabbed out like tabs in a chart. So he can come in and, maybe in addition to her annual visit, the patient didn't want to tell the nurse of another problem she's having. So the doctor at this point could come in, add a second HPI item. and then go ahead and, chart the findings based on his interview with the patient.
What's your name?
He could then come in and look at the review of systems here, add and make any changes as necessary. All right, that you get the same functionality here. If I click in here, I can get right to that globally normal gin, which fired it in. And yet, again, he can go in and drill deeper, into the body systems and do them there. So from here, come on, save and close. There we go. You can hit the next button here, and again, I'm such in a habit of going tab to tab. If there's anything on histories he needs to review, he can see there will be her pregnancy history. He'll see family history, med-surg, social history. Everything will be in there. He can add or make changes as applicable. Then he's going to go in and, complete his exam. All right, so remember, we're not going to break down and use any of these up here. We're going to stick with this quick exam. Because this is the one-shot template that, one, lets you document your chaperone, okay, whoever's in the room with you. Two, lets you either utilize the next-gen normal well woman exam, so you could fire that one in, or if you've built your own, okay, after I fire this one in, maybe I want to add a couple more things into it, because this is the exam I do, and I want to use this one every single time. I'm going to come up here to this Save Diskette, and I'm going to save it for future use for other patients, charting by exception. I'm not going to save another one in there, because I do believe I saved one yesterday. So Dr. D's well woman over 40. So I could fire mine in. So you can see it just kind of updated. So remember, these are all norms. You're charting the exceptions. If something was out of the norm, like maybe for respiratory, we'll say on the left side of the interior, the inspection was she had some little labored respirations. It's going to automatically uncheck your inspection from normal, because it's obviously not normal now, and update that as well. But the big thing to remember over here is two things. Do you do an FOBT at a well woman exam?
What is it?
Do you do a fecal occult blood test?
Yes.
Okay. So two components here, and I actually forgot to mention this yesterday. So that test is done. All right. If we say it's negative, we're going to click negative. It's going to fire up a pick list. I can tell you right now, this is a database pick list we're going to want to edit for you, or you're going to want to edit, because to me, if it's negative, everything I see in here looks like it's for a condition. So there isn't like a screening code in here. So a screening code would need to be added to this table here. So if it's negative, I can just grab the one that says negative or screening code. Because once you do that, okay, and when I hit the submit the super bill and save and close, it's also it's going to bill for the FOBT too. Okay, now we also talked about the PAP yesterday. Did we say we were going to do it from here, or are we going to do it from the plan?
From the plan.
Okay, all right. So if we're not going to do it here, we're just going to leave it as it is. We're not going to chart anything. All right, we're just going to, at this point, hit save and close. All right, so that completes the exam. If there were any other procedures done, we're getting close to running out of time here, so I really don't have time to go through these. But Liba and I went through these yesterday, or the ones that were applicable to you. All right. So from that point, doctor can move on to his assessment and plan. Okay. So we're going to go ahead and add a common assessment. All right. So it's going to pull up the GIN assessment template, and we can do routine GIN exam. Save and close. Now that one right there, whoops, that was interesting. This one right here is very normal, and it's one that the doctor will use all the time, so I think they should add it to their list. All right, so the next time if I came in to, any point to get my list once, if I click in Add Comment, I can just click in this little field here, and, didn't update for me. Why didn't it update for me? Let me come back out and save and close. I did pull the trigger on it. And I'm not sure why this template keeps firing up on me here. So routine gyn exam, add it to my list. I'll come back and check it. Maybe just hasn't had a chance to update the table. But again, we're going to put the assessment in. Then you're going to come down to your custom plan. All right, and this again is where the physicians can start to build. And again, you're going to benefit because you already have predefined more gyn-related order sets in here already predefined by NextGen. So when you pick this gynecological examination, you're going to see here it pulls in things like your pap smear. So if we did the pap smear, we're going to check it off. If we talk to our patient about monthly breast exams, increasing activity, if there are any other tests that need to be done, okay, remember you can build your own too, but once you utilize and you've checked off all the items, you're going to place the order. And that's what's going to put the order in for the items that you did. So you see it cleared the template. Now I'm going to hit save and close. Okay, so here's actually an order that came up that has to be, we have to submit these. It's kind of interesting how this works. You don't have an interface yet, but once you do, when you click in this vendor field here, you'll be able to pick your vendor, like LabCorp. And then what we can do is we would just say automatically perform, include, or remove action on row select. We want to actually take this and we want to fire it down here so it's going to be sent to the vendor electronically. So once that's done, you would hit process it and it submits it, and that's what would send it out electronically. All right, and it's not going to work here because we don't have an interface going. So there's my order. So if we look down here, you're going to see there's the urinalysis we did, there's the pap smear we did. All right, so when the results, either before your interface is up and running, of course your results are going to interface back in, but until then, in orders management, yet again, we could come in and manage this order and say the result was received, it was normal, task the doctor. There's many ways to notify, but I probably think when your results come back in the beginning, they're going to be scanned in and go to the doctor's PAQ. You all familiar with the PAQ?
PAQ, which?
Provider Approval Queue.
That's the provider, okay.
Yeah, fabulous part of the application. Love it. And then the last thing he's going to do, again, if he has to do any medication orders, okay? And you see I actually edited my toolbar up here yesterday. I showed Liba. I pulled the medication module up here because this is one for sure that doctors are accessing frequently. So instead of having to click on history and grab it down here, which isn't a big deal, but it's, it's kind of nice to have it up here too. So they can grab it right from there and do their orders.
Can they put
And then
one item up there?
Very simple. Just hovering over your toolbar up here. If you right-click, you can go to Custom, and that opens a little window where what's available. Okay, and you can see these are like all the items that are in the history toolbar. So you can take any of these items and add it. When it first fires in, it's going to fire in all the way over here. If you can see, I'm kind of circling in the big circle here, right next to this logout button. Then you can just highlight it in the list here and move it into any position. So like if I went to pull templates over now, templates is actually going to fire in before meds now because I've added one. All right, so you can see, oh no, it didn't. It stayed over there. Okay, so there's my templates. Of course, I don't want them over here. So I highlight it in the list and I just start moving it down. And you can see it's moving with me as I click.
Yeah.
All right, and I'm a creature of habit now, everyone. This is a update to the, an enhancement to the 7.9 database. So I'm putting everything after my separator line because I can hit these buttons blind if I need to, to click on them just because I've used it so much. Well, I wouldn't say blind, but so I don't want to mix and match and put modules up there that I'm not used to having. So I'm going to just keep moving it down, 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 and I'm going to put it after my medications. So one more click, and there we go. So there they are right there. Don't hit reset. Our first thought is to hit okay, reset. That's like the okay button. That's actually going to take everything out that you just put in. Just hit the close button, and you can see it's all runtime. So after, again, doctor's given education, he's done medication orders, he's all set with the patient. If he's done, all right, like I said yesterday, I rather my doctors generate their note first, okay, before they do any charting. Any coding. You know, maybe they're not going to code it just yet, so they could track it as charting complete. But once they're ready, you know, again, it's provider preference, but in the beginning, I know a lot of doctors like to look at their documentation before they code it in case they feel like they missed something, or, you know, if you need to add more to the master. And the reason I say that is because if you missed items that may increase your coding points, if you've already generated your code and saved it to the charts and that component is now done, you'd have to manually go in and change it. So that's just a little something to think about. I think over time, you know, the doctors, you know, are going to get comfortable with their workflows and know that they can code it and then go generate their document. You know, maybe code it and send these documents offline to generate, so they don't have to sit here and wait for it to finish scrolling through. So here comes my note. So she came in for her annual visit. So once the note is generated, because you've got to have a chart note with every visit. All right, and then they would come in to their finalized, all right, and then they would do their any patient advice if they talked about, you know, doing monthly breast exams, continue on any continued treatment, discuss, you know, stroke risk with birth control pills if they were a smoker and over the age of 35, instructed not to drive while taking medications. You can see it's just all concatenating up here and making a little note.
What's the medication?
All right, and then they can fire right down to their E&M coding.
ZA or DA?
All right, so again, it pulls in the visit type. If they selected the incorrect one, you can just click in the field to update it. It's going to give you that same pick list. And you'll notice, everyone, this pick list does not have a free text line in it, and there is a reason why for that, because the coding is driven. It is so intricately triggered behind the scenes to look at your visit type code to pull the correct code in when it calculates. So we'll say this was a, you know, low complexity. There were no problems here, and we'll go ahead and calculate out the code. I hope I did enough to get it. There we go. So I got a level 8386. And if we were happy with that, we would just submit the code. And you're done. So just that fast, everyone. I'm going to fire over to EPM. So we just did the billing out of the patient's electronic health record. Now I'm going to fire into EPM. It's going to synchronize. It's going to log me right into EPM, and it's going to open my patient's chart.
Please call extension 8003, Adrian.
It's loading the advisor, and upspires. I don't need to read that.
Saturday, 2:45?
And there we go. So there's Mary Test.
3:45.
So for everything I did for her today, all right, I'm going to come to encounters. Here's her encounter from today, just show you how fast this is. And I'm going to go to her charges. I'm not going to accept them, but you'll be able to see them. All right. So I've got two charges there, one for her visit and one for the urinalysis. That's how fast they come over. So I'm gonna cancel that because I don't want to fire those charges.
And from this window, from this window, where do we find the referrals and stuff from the EPM?
I am not an EPM guru by any means, everyone, but if I come into clinical history and notes over here, here's referrals and stuff. You can actually, like, we've got some items in here for history under encounters, okay? But, again, I'm not an EPM guru by any means. It's kind of interesting, but there's the EPM trainers and the EHR trainers, and EPM trainers don't really know EHR and vice versa. Yeah. I'm slowly learning it, you know, just over my almost 4 years at NextGen, I'm slowly learning it. I know enough to schedule an appointment. Okay. All right, so that's basically it. And then again, and I went over this with Liba yesterday on the E&M. Oh no, it's actually not on the E&M coding template. It's on the finalized template. We went over the document library. Okay, but right down here at the bottom, they just placed some shortcuts for documents. So you could preview your office visit right here. You could generate a patient plan. If you were going to refer this patient out, we could actually click once and generate a referral request letter and fax it right out of the system to the doctor we want to refer them to. So this is generating the referral. You have so referral, thank you and request, consult, thank you and request. Trying to think, I can't think what the other ones. You would think I would have them memorized, but I don't. All right, so it's doing its thing, it's thinking, it's evaluating everything it's going to pull onto this document for you. Whew. Okay, there we go. I'm just going to toggle over to, and you all can go in and look at all this now that we've generated it to these charts. If you did procedures, you can just, generate a procedure note. But the document library is fabulous. Love it. Okay. Now, just quickly, because actually I need to hop off this WebEx in just a minute and get ready. I got to eat a quick lunch and then get on to my next call. But one thing I did want to show you yesterday, because Liba and I talked about it. Liba, are you still in the room?
I'm here.
Yeah. Her and I talked about missed appointments and recalls. So if there's a template actually in here, I'm going to go to history. Actually, I moved my templates up there now. If a patient's a no-show for a visit, if you come to your templates, we have a template called, and I haven't pulled it in my list of preferred, it's actually called missed appointment. So if your patient no-shows for their visit, you can actually document the chart. You can create an encounter, pull in this missed appointment, okay, and we can indicate that maybe this patient was just a no-show, and time of her appointment we could say was at, say like 10 o'clock, so 10 o'clock, and it was a.m. with her doctor. Put a little note in here, third no-show by patient. All right, so it helps you, keep track on that. Once you save it to the grid down here, then you can say which action you took. Did you send a letter? Did you send a certified letter? Did you call and leave a voicemail? So if you did this, if I called and left a voicemail, all right, I would submit this to start building a log to indicate that she was a no-show. And then I can actually task this to the doctor to let them know that this is this patient's third no-show. So, again, managing your patient's care, it's kind of nice. And then you can generate the document. And then you can actually go right to the document library. Let's say you indicated you sent the letter out. You could send a missed appointment reminder out. So that generates a nice little letter that can be printed and mailed to the patient. So nice stuff. And that's all I have, ladies.
Okie dokie.
All right. Well, I thank you all for your time. I hope you found this beneficial.
Yes, it did.
Good. And what I'll do is I'll get my reports out to you, and if there's anything I can think you could benefit from, as far as some training material, I'll forward that along too. So I'll give you your computer back.
Yeah, thank you. Thank you.
Thank you, everybody. Have a wonderful
day.
afternoon.
Yeah, have a good day. Yeah.
Thank you.
Thank you. Bye-bye.